distinguished men of the press, ladies and gentlemen, we welcome you to our press conference to commemorate this year's World Malaria Day 2024. World Malaria Day is celebrated annually. For the 2024 campaign, World Health Organization and the Rollback Malaria Partnership will amplify the theme, accelerating the fight against malaria for a more equitable world, highlighting the critical importance of advancing health equity, gender equality, and human rights in malaria responses worldwide, with the slogan, "Let's change the narrative now." According to reports by the World Health Organization, infants and young children continue to suffer the greatest mortality. In 2022, an estimated 4 out of 5 malaria-related deaths in the African region were among children under 5 years of age. Pregnancy has also been known to reduce women's immunity to malaria, making them more susceptible to infection and increasing their risk of severe disease and death. If left untreated, malaria in pregnancy can cause severe anemia, maternal deaths, stillbirths, premature delivery, and low birth weight in babies. Public health is one of AYGF's 7 thematic areas with a major focus on malaria, gender-based violence, mental health, and nutrition. Through the ARIN project, that is the Accelerating Nutrition Results in Nigeria, a World Bank-funded project, AYGF infused intermittent preventive therapy for pregnant women, IPTP, a malaria prevention component that focuses on pregnant women and the administration of sulfadiazine and pyrimethamine monthly at the beginning of the 2nd trimester. Through this intervention, AYGF in 2 years has reached up to 1,373,674 pregnant women in Niger State alone, and then 273,976 pregnant women in Katsina State, and 727,679 in Kogi State. These are the 3 states where we implement the World Bank-funded ARIN project in Nigeria. That is the states handled by AYGF. The entire focus of this component is to prevent malaria among pregnant women and protect their children. Last year, AYGF and its partners commemorated World Malaria Day in 2 rural communities in FCT, where malaria prevalence may be high, to reduce the prevalence of malaria in these communities. This year, AYGF intends to commemorate World Malaria Day 2024 on Thursday, the 25th of April, in partnership with MNEP, that is the National Malaria Elimination Program, and other development partners who share similar interests in eradicating malaria in Nigeria. As part of the celebration, advocacy and sensitization have been carried out in designated places of worship on Friday the 19th and Sunday the 21st of April 2024, while a community outreach was conducted yesterday at LA Primary School in Pape. The final will be on Advocacy Roadshow and ministerial press briefing on Thursday the 25th of April. The roadshow will begin at the Federal Secretariat at 8:30 a.m. in the morning and end at Rockview Royal Hotel by 11 a.m., where the press briefing will be held by the Honorable Minister. In AYGF, we believe that everyone has the right to quality, timely, and affordable services to prevent, detect, and treat malaria. Yet, this is not a reality. As a result, we are making the following recommendations, both to the government and other stakeholders in the sector. Number 1, engaging communities in health decision-making. Community needs are best addressed with the environment of its members, with involvement of its members, soliciting for buy-in that ensures sustainability after intervention. These interventions can be sustained when community members see the need and drive the cost, ownership, and transcending in improved results long after the intervention has ended. 2, addressing factors that increase malaria risk. Malaria is an ever-growing issue that will continue to affect and spread throughout Nigeria if measures are not put in place. Sensitization and awareness campaigns enlighten communities on healthy practices, bringing healthcare closer to the people to prevent malaria and reduce the prevalence of diseases in the country. Another approach is to improve access to healthcare among vulnerable communities through the delivery of affordable healthcare to hard-to-reach communities across the country. 3, adoption of universal healthcare coverage. In Nigeria, a large part of this country currently falls in the low-income category of living, making affordability of healthcare quite cumbersome. Therefore, a need to adopt universal health coverage, ensuring that all people have access to full range of healthcare as needed without financial restraints. 4, immediate action and collaboration. The change we seek in healthcare cannot be done alone. This is why, as an organization, we have identified the need for relevant partners or partnerships that will spread the cause of impact beyond communities to the country at large. As we join the rest of the world to commemorate World Malaria Day 2024, let's unite to accelerate the fight against malaria for a more equitable world. Thank you.